My name is Mehmet Asım Bilen. I am a geomedical oncologist at Winship Cancer Institute of Emory University, and I'm the director of Genitourinary Medical Oncology program, and I'm the associate medical director for the phase 1 program here at Winship. For like a hereditary syndrome in kidney cancer, in many individuals with renal cell carcinoma, hereditary causes may have contributed to cancer development. Various risk factors are associated with those like syndromes, and some of those features are like early age at renal cell carcinoma diagnosis, and we typically use age less than 45. The kidney cancer in both kidneys is also like alert us. There may be some like a genetic background. Multifocal kidney cancer like is also very important. A strong family history of renal cell carcinoma, like such as more than or equal two relatives in the same bloodline, that is also trigger us to get some like evaluation to rule out like hereditary syndromes. In addition to those, renal cell carcinoma with personal or family history of more than or equal to one tumor type, such as pheochromocytoma, brain and spinal hemangioblastoma, pancreatic neuroendocrine tumor, retinal tumor, papillary cyst adenoma, GI stromal tumor, uterine fibroids, like and particularly age less than 35, uveal and cutaneous melanoma, and other solid cancers during childhood are very, very important for like rule out hereditary syndromes. Like when I see patient in my clinical practice, I go over those, and then like if there is any like a sign, I think this is the time that we need to think about, is there any like a genetic background? Because genetic counseling and understanding the entire family tree are the first step. And the result of the testing and knowing those, I think is very important, because there's an implication for the patient and also there's an implication for the family members, because this will affect our therapy decision. Like, for example, if someone with hereditary leiomyomatosis RCC syndrome, and now we have like a prospective clinical data suggesting the combination of erlotinib and Avastin might be like helpful for those patient population. In addition to that, that information might be important for clinical trial enrollment. Like I think in like many institutions, we have molecularly driven clinical trials, and I think knowing that information can also affect that decision. But overall, working with medical genetics department is very important because in my institution, I work closely with my medical geneticists, and we follow those patients together. And I diagnose number of patients with hereditary syndrome, and then after that we screen their family members, and also found that there is some family member carry those alterations or mutations. And in those particular population, I think early screening and prevention is very, very important. Because of this reason, knowing that and working with medical genetics and screening for those are very important.